Today I have come up with another kind of personality disorder, that is ClusterC Anxious Avoidant Personality Disorder. As the name itself clears out, anxious avoidant, that means the person is more of the time being anxious, fearful, and tries to avoid the social situations. The characteristics of this disorder, personality disorder, is that the person is most of the time shy in nature, and he tries to avoid people, avoid meeting interpersonal relationships, unable to develop a good and healthy relationship with others. He feels himself an unattractive, social disinhibited, feeling of inadequacy, and they feel that they might be rejected or criticized by other, and as a result they try to avoid the situation where they have to interact with the people around. This characteristics becomes an eminent features of anxious avoidant personality disorder. As a result, they face problems in their workplaces. They are unable to carry most of the important features like social gathering, social marriage, social parties, and these things some of the other way hampers their daily functioning life. They feel themselves uncomfortable and they try to avoid their situations because they are not able to make a good, healthy relationship with others. They feel themselves discomfort in making relationship with others. Actually, if you are going towards the causal factor itself says that there might be history of bullying in the childhood or early childhood traumatic experiences of rejection, any history of abuse, or there must be some family discord which as a result they are not able to build up their personality and they remain fearful and anxious most of the time. A very important feature is that if the family environment is not good during the childhood, they might have suffered, or the parents are being divorced, or separation in the family, or there is a critical comment or expressed emotions are present, then patient might suffer from these kind of characteristics. Then he or she might feel like that I am not able to do. As a result, he tries to about to doubt on himself and says that initially that I will not be able to do this work comfortably. Self-doubt characteristics is more often found in anxious avoidant personality disorder, and because of the fear of being rejected and criticized, they try to avoid that situations. They feel that anticipation of humiliations and rejections becomes so overimposed on them that they are not able to go in smaller places where some of the other way their functioning, their daily living functioning becomes difficult to carry out. Coming towards the treatment of anxious avoidant personality disorder, psychotherapy plays a very important role in treatment of anxious avoidant personality disorder, because some of the other way anxiety is associated, the fear is associated with the person. So we need to focus on this, and the faulty cognitions and the negative feelings about themselves. Again, the cognitive behavior therapy plays a very important role in changing an alternative thoughts about themselves, that how they are assessing themselves and their apprehensioning about the future, humiliations and rejections. So CBT plays a very important role in developing their personality. Other than this is supportive psychotherapy by externalization of interest, by motivating them, persuading them, we can help them out to fight in different social situation and become a presentable form. Again, the family therapy also plays a very important role, because since I said that the causal factor must be some problems in the family, so that family can also motivate them and help them in fighting with these problems, these fearful situations and this thought of being rejected. So here the psychoeducation and the family therapy plays a very important role in developing and supporting the patient to overcome their problems. Friends, this problem is basically associated with the apprehension of the fear on the basis of the past experiences of rejection. So, with this, we can work on the patient with the precipitating factors. We can work with the patient and help them out to come from these problems. So, please, friends, do take care of yourself. Take care. Bye.